Thank you so much. We will take questions after the three presentations because they're linked. In fact, it's my honor to build a bridge between the fascinating tale by Sumit about scaling up services for children in India, the country with the largest child population in the world. A bridge towards Caroline, who will speak about provision globally, internationally. And I felt that to build that bridge I needed something solid, a framework, something that's strong. And I found that in the SDGs, the Sustainable Development Goals that will succeed the Millennium Development Goals. This is a fascinating document. It has some people goals, it has like the old MDGs, it has some planet goals, and at the very end, goal 17, is about creating the conditions to achieve all those goals, and finance is the first theme of that goal number 17, and this is it. There are 5 sub-goals, and this is an excellent framework for us. Number 1, and I'm delighted that it's number 1, it's domestic resource mobilization, what countries can do themselves. Number 2, ODA, official development assistance, the role of the donors, foreign contributions. Number 3, additional financial resources from multiple sources. Maybe we can say that's the alternative, the innovative. And then, well, number 4 is about debt sustainability, which is very important, but it works through number 1. Because if countries have debt relief, it will have more scope for domestic resource mobilization for children. So I won't talk specifically about debt relief. And finally, investment promotion regimes. I think it concerns investment in the more industrial sense of the word, agriculture, industry, infrastructure. But if it doesn't, it would still work through number 3, the alternatives. So basically, we have a framework of 3 key elements: domestic, ODA, and the additional financial resources. Domestic, foreign, innovative. Very simple. And this is the framework for my presentation, which is going to be very short. Domestic resources. You can visualize that like an hourglass. You have tax revenues from the country, right? Domestic. Coming in from several sectors. It is channeled through the treasury, where there's a process of allocation and budgeting, and then it's disbursed to various sectors. There's the spending. It goes to the ECD sectors like social affairs, health and education, but also other sectors like infrastructure, agriculture, anything, to emphasize that ECD competes with others, always keep in mind. If you want to increase the absolute amount of spending on ECD, there's a couple of ways, and some are difficult and some are promising. Number 1, you can decrease other budgets. It's politically very difficult. Take away budget from others. You can raise tax levels. Not very popular. However, here's a sidestep. Although we don't like to pay taxes, and although economists will tell you that high tax levels are bad for the economy, countries can also have too little taxation. The indicator is tax revenue as a percentage of GDP, and that's really not be below 20 or 25%. If it's around 10, 15%, you just don't generate enough resources as a country to finance all those services, including ECD services. It really should be something about 25 up to 50. 50 is the limit. Increase the government deficit. That's another thing that is not done nowadays. Fiscal discipline is so important. No country will do that anymore. But now we get to the promising ways of increasing the ECD budget. First, economic growth. The next slide will tell you that there is a lot of economic growth in developing countries. And if that comes in, you can increase tax revenue without increasing the tax levels. Right? You can still have income tax of 20, 25, 30%. You keep that percentage, value-added taxes at 15% or something, you still have more money coming in because people will earn more. Second, enhance the efficiency in government spending, reduce the leakage, combat tax evasion, in other words, good governance. One sidestep. I once worked in a country, and which country is not important, and this country had identified a number of essential child services across health, education, and social protection. They had fairly high enrollment levels already, and I estimated the cost of universalizing all those services, only to find that the country was already spending that amount of money. It was not reaching all those children because of In that case, ECD sector or the ECD sectors are not free from corruption. I used to think that, I used to like to think that, but very important in a lot of countries, high, low and middle income countries alike. Money leaks away, and ECD is not an exception. You would think so because it's for small children, but it exists. It's really important and it's major. And then finally, you can promote private provision so that more public money is left for services for the poorest. However, you have to keep in mind what I call systemic coherence. If you have a public subsystem, and maybe it's difficult to keep coherence, to maintain national standards, etc. Now, this is the transition, this slide, from number one, the domestic resources and the foreign resources. And the question is, in this slide, where are the donors and where are the recipient countries? What you see here is economic growth, right? It goes from 0% to 8%, and you have a timeline from 2014 to 2018. I don't have time to talk about all the lines, but the donors are at the bottom. The lowest is Japan and the Eurozone, only slightly higher the USA, and that covers 90% of your donor countries, the traditional donor countries. They're not growing, hardly growing. At the top, you first see China. It goes down from very high levels to more sustainable levels. China is really a story apart. But then right below it, it's Asia, your region, and these are the developing countries of Asia, excluding Japan and China, and the light green line going up steeply, sub-Saharan Africa. So what we see here is the tendency, the richer the country, the lower the growth. The poorer the country, the higher the growth. That sounds like a paradox. It seems to make almost no sense. But in reality, there is a strong reason why that is the case. I don't have time to explain. There's also a reason why this is likely to remain the case in the next 15 years. There is a lot of economic growth. Of course, the figure for Africa hides the disparities. But really, this is so very important. Before drawing the conclusions, I have one sidestep to make, which is demography. These are the demographic profiles of India and Niger. Niger is one of the last 10 to 15 countries which has a high fertility rate. It is extremely difficult in such a country to universalize child services if each age cohort is larger than the other one, with only a very small working population. But look at India. It has made the transition to low fertility about 20 years ago. You have a totally different dependency ratio. The number of working age people is much bigger compared to Niger in relation to the number of children. So this is another reason, again, no time to really explain it, but another major reason why universalizing child services in the next 15 years is going to be much easier than it was in the previous 15 years of the old MDGs. The conclusions, I'm sorry. So, as we see high economic growth in many, not all developing countries, this is a promise of raising significant public, domestic resources for ECD, so that ODE, the foreign assistance, can focus increasingly on countries with growth or high fertility. The problem is shrinking, in a matter of speaking, and the foreign efforts can be more focused. More in general, where you still have donors, NGOs and faith-based organizations, etc., CSOs, they may focus increasingly on creating conditions like capacity development, not only for programs, but especially for policy development, innovation, research, what have you. Maybe capital investment, building hospitals, building dispensaries, building school buildings. But the thrust of recurrent funding, salaries, supplies, operational costs, should be domestic, hence more sustainable. Domestic resources are the most sustainable resource, and we go increasingly in that direction. With regards to innovative funding, we should distinguish innovative mechanisms from alternative sources. These are two different things. You can have innovative mechanisms and still rely on domestic resources. Per capita funding is a great innovation, but it simply comes from domestic sources. right? Results-based budgeting, performance-based contracts, also known as social impact bonds. Eventually, it's the government that pays from regular tax-based funding. Finally, your last point is basically a dilemma that I simply like to pose to you because I don't have the solution, and it's the most crucial dilemma, I think, for the theme of this conference. In as far as we rely on the private sector and NGOs, and in as far as we even move further in that direction, this may have the adverse effect that we lose the prospect of funding from sustainable domestic public sources. I've seen in a number of countries that policymakers say, wait a minute, ECD, oh yeah, that's NGOs, that's the church, that's the mosque. Great, no, that's fine, because we don't have the money, leave it there. So the moment we come up with innovative approaches, and this does not apply to all of the innovative approaches, we should really be careful not to enforce that old thinking. Because this idea of ECD is for others and not for the government, may be reinforced. And this is just a dilemma. I don't have the solution to that. What I do say is that, and this is my final statement, the prospects of raising domestic resources are really better than ever because of economic growth, low fertility. And I think we're going to go towards a great next 15 years. Thank you. And I'd like to give the floor to Caroline.